So my focus is saying, okay, what are the important health pieces that need to be in place? And can you do those within different industries? Which industries or which business models have more interconnectivity? Which ones can you modify? So, we talked about not traveling. So business travel is something that we need to think about. Having meetings and getting used to having at least partial virtual meetings and not having people coming together in the same way. So those are the parameters that we're putting in place from a health perspective. And testing becomes incredibly important. We've opened up our testing again because we want to make sure we're detecting every case that we can in the province. Going forward, it will also be really important. And there'll be two parts to it. So one is the testing that we continue to do, the nucleic acid testing or the genetic testing to see if somebody has this disease. But we are also, and we've talked about this, going to be adding in the serology testing. And I expect we'll have the ability to do that in the coming weeks before we start opening up. And that helps us in a couple of ways. It helps us understand if the people who have been infected and have survived this disease over the last few months have immunity going forward, and we do expect that they will. So we can do testing in our healthcare workers, for example, to give them confidence around being able to care for people with COVID-19. We also can do broad testing in our community of a sample of people to get an understanding of how many people were truly infected. As you know, we haven't tested everybody who's had signs and symptoms of COVID-19 in our community over the past, at least the past month. Because of a variety of reasons, we needed to focus the testing on those that were more likely to have it and more likely to end up in our healthcare system. So we are now opening it up again like we did in January to see if we can detect everybody, and we need to be able to have the public health people to respond to that. So serology is a way of looking back and saying, okay, how many people actually did get infected, and giving us a better sense of the true numbers of cases in the province. It also is a way of helping us if we start to see cases pop up. So if somebody ends up in hospital in July with COVID-19 pneumonia, where did they get it from? And it helps us in our public health investigation to say, okay, well, there was unrecognized transmission in these people, and that helps us contain and prevent transmission in clusters and outbreaks going forward. So serology testing will be an important part of our future.
I think, just to say, I think the last time the legislature met, I was asked about how long we expected the public health measures to be in place, and I think said at that time, and it was seems like a long time ago. I think it was about March 23rd that these measures wouldn't change until the end of April. There was zero chance they would change, and in fact, that's the case. Where these measures have to continue to be in place. We have to continue to flatten the curve. We have to continue to succeed. In terms of the economy, what we need to do, and the work that Dr. Henry will be leading on the health side with Steve Brown, and the work that the whole of government is dealing with on the economy is going to be considerable in the coming weeks, and we're going to come back to you with more modeling and more discussion, more dynamic modeling in the very early part of May, so that we can start to develop a framework. It won't be necessarily one industry. You know, and this is, I think, to the great credit of Dr. Henry, who understands and cares, I think, very deeply about what sometimes are called the unintended consequences, that are really the understood negative consequences of necessary health decisions. That there are many sectors of the economy right now which are continuing to operate and aren't in other jurisdictions. And this is proven to be an effective response. We've applied, Dr. Henry has applied the science to every case. And so as we look at industries, regardless, and imagine the industries in BC, that's going to have to continue to be the case in the months to come as we deal with the new normal. But you're going to see in approximately a couple of weeks, maybe a little over a couple of weeks, new modeling and a new framework for how everybody needs to act. And that will have different implications for different industries, of course, because different industries deal in terms of issues of physical and social distancing differently. But I think what I can say is that that this has been consistently our approach, consistently the approach taken by Dr. Henry. It's proved effective so far, but we are going to continue to do what we've been doing, which is follow the advice of Dr. Henry and her team in guiding and directing what we can and we can't do, but also, of course, working with all industries in the province to see what is possible in the coming weeks and months.